President Obama's health care reform proposal gets a big boost on Wednesday when a key Democratic lawmaker said he would support the bill. Ohio Representative Dennis Kucinich became the first member of Congress to support the plan after initially voting against it. Meanwhile, in an interview on Fox News, the president bristled at questions about the process the House may use that would allow members to pass the bill without even voting on it.
I don't spend a lot of time worrying about what the procedural rules are in the House or the Senate. What I can tell you is that the vote that's taken in the House will be a vote for health care reform, and if people vote yes, whatever form that takes, that is going to be a vote for health care reform.
For more now, we're joined by Kasie Hunt, Congressional reporter for Politico. Good morning.
Hi, Michelle.
Kasie, tell us about that process and why it's gotten the GOP so up in arms.
Well, essentially, they want to use a process called deem and pass, where the House makes changes to the bill that the Senate has already passed, adds them on top of that, and then only has to take one vote on the entire package. Basically, there's some controversial elements to the Senate's bill, and it's going to be harder for Speaker Pelosi to get the votes she needs if representatives have to take a vote just on the Senate package. By adding it together, she's more likely to get the 216 votes that she needs.
How important was it today, Mr. Kucinich, changing his mind and supporting the bill? Is this the first of many that will allow them to have the 216 votes needed?
Well, it could be. In Mr. Kucinich's case, he's a liberal who really wanted the bill to include a public option. And he came out and said, okay, this bill is more important, President Obama's presidency is more important than the public option, so I'm going to go ahead and vote for it. It could give a little bit of cover to other liberal members who are still on the fence or who are angry about how the process has gone. You know, they feel like their priorities have been steamrolled throughout this process in catering to moderate Democrats in the House. So it could give some others some cover. Rep. Raul Grijalva hasn't come out quite yet and said whether or not he will support the bill. Those kinds of things.
We've been talking about health care reform for a long time now, and I know that there was a sort of soft deadline set for President Obama's trip to Asia. Is this likely to happen before then?
Well, President Obama delayed his trip to Asia, of course, until Sunday, but we actually heard tonight from House leaders around dinner time that it doesn't look like they're going to get the numbers that they need. They're not going to find out how much the bill costs until at least tomorrow. So that pushes their three-day window past Saturday. We were hoping, or they were hoping, for a Saturday vote. Instead, it looks like the vote might not take place until Sunday, which is when President Obama is scheduled to leave.
And if that vote goes through and health care reform is passed, two states already, Idaho and Virginia, are threatening to sue Congress. I understand it's more of a symbolic move, but explain to us what could happen there.
Well, sure, it is, but the Republicans are preparing a variety of legal challenges to the bill once it gets passed. If the bill passes as it stands now, it contains an individual mandate, which means every person will be required to carry health insurance, with some exceptions. That is seen as the federal government coming in and saying, okay, you have to require this of all of your citizens. There are some questions as to whether or not that's allowed, considering states have their own rights under the Constitution. So you probably will see a litany of legal challenges if this bill does become law.
All right. Kasie Hunt from Politico. Kasie, thanks so much.
Thanks, Michelle.